Mental health is talked about in our community everywhere today, but when Coast started in 1972, that wasn't the case. Beginning in the 1970s, psychiatric hospitals actually across the world were being phased out. And what happened is people were left in the community without the same supports they used to have when they were in hospital. Back in the early 70s, when Coast was formed, it was just a bunch of volunteers with a vision to support people with mental illness in their recovery. Now, 5 decades later, we continue to make the difference in people with mental illness recovery. We have 800 people working day in and day out to make that difference.
Mental health challenges can easily lead into other issues like housing insecurity, lack of employment, substance abuse, and more. If you don't get help on all the fronts that you need, the chances of recovery and living a full life are so low. That's why we've been supporting and donating to Coast Mental Health for all these years. They're the only organization covering the breadth of wraparound services we see leading to a full recovery of a person, and seeing those individuals feel like their life has a purpose.
Growing up with an abusive mother and an indifferent father worsened my schizophrenia, and the breakup of my relationship with my fiance turned me towards illicit drugs and alcohol to cope. When my father passed away in the spring of 2019, it made me realize that I'd squandered the last 20 years of my life, and it was time for me to make a change. I worked hard and I got clean, but the difference was this time I had Coast Mental Health supporting me in my recovery. Getting supported transition back into the community made a huge difference. There's so much care and compassion with Coast Mental Health, and without them, I'm sure I'd be either on the street or worse, dead. I'm turning 50 this year, and I'm deeply grateful to Coast for the renewed sense of meaning and purpose they've given to me in my life. Now I just want to give back and help others, and Coast allows me to do that.
If you've always had housing security, it can be hard to imagine sleeping on the streets. You expend all your mental and physical energy just to get your most basic needs met each day. Once you have a safe home, healing can finally become a focus. BC Housing is so happy to be partnered with Coast Mental Health on a number of our assisted living properties. They have been leaders in offering a spectrum of supportive housing so individuals can get the level of care they need at every stage of their mental health journey.
When Gary was diagnosed with schizophrenia, his psychiatrist recommended Coast Mental Health. He's been helped by Coast Mental Health for over 30 years, first at a group home and then in an apartment once he got better. Coast Mental Health has been instrumental in helping his recovery. And when he had to go to hospital a couple of times, he always knew that there was a place to come back to, and that helped. Coast has helped Gary so much, and we appreciate it, which is why we've been supporters for 25 years.
The Clubhouse is one of the first programs Coast started and is based on the Clubhouse model. Here we are all equal, so the staff is right alongside the members and we are doing everything together. As a pre-vocational program, we aim to transition our members into employment, schooling, and part of community. Coast Mental Health has made the difference to change stigma towards mental illness in the past 50 years. So our members can make that transition more easily when they are ready. Members participate in running our Clubhouse. They work on punctuality and working towards a schedule, while building confidence and building skills and building friendships with peers. Working as a team, plus the skills taught in our program, helps prepare them. When a member would like to work, we start with a goal plan. Once they demonstrate their job readiness skills, we start them in our transitional employment program, where they can choose in job opportunities like street cleaning, janitorial, power washing, and landscaping. It is very rewarding to have a job and build skills and work in a supportive environment, where they are allowed to take time away when they aren't doing well and need to take care of their mental health, and are welcome back when they are feeling better.
The opportunity I've had to work with Coast Mental Health has shown me how they are really bringing about innovative programs. And that's using research as a base for it, and then planning how they're able to do this best for the people they work with or for people who are residents of their buildings. Research into improving services requires a number of things. The large number of people that Coast Mental Health serves is certainly one element of it, but it's also that drive to be able to say, how do we manage this data and show it can improve the things that we're doing. The things I've seen are remarkable, how the staff respect individuals, how they understand and are informed by the things they've been through, such as trauma in their past, and then how they use that as a team to try and have an approach which is multifaceted and consistent. That's how you bring about real positive results.
This year, as I celebrate 35 years at Coast, I am so proud of our 800 staff and our volunteers and the ways they make a difference in the recovery of people with mental illness. Coast is only able to do this work because of our incredible staff, our partners, our donors, and our volunteers. So on behalf of everyone at Coast Mental Health, please accept our sincere gratitude for your support to make the difference in the lives of people with mental illness for the past 50 years. We look forward to another 50 years and more with your support.